Good morning, Senators. Michael Emanuel Rayner, a person living with HIV/AIDS and also a client of the AIDS Drug Assistance Program. Thank you, Senators, for hearing and acting on the HIV community's concerns that I brought to you originally back on January 14th. This committee and the Senate and even the House have demonstrated that they have leaned in, engaged, and had thoughtful conversations and have shown a genuine interest and good faith to make sure that people living with HIV/AIDS do not go without their medications. We realize that if a person is able to suppress the HIV virus by remaining on their HIV medications, that HIV is not transmittable from that individual. So treatment is prevention. However, half of the 32,000 clients that are in this program are in panic for their lives right now. Without having access to these medications, they will end up in your local emergency rooms, transferring the cost to and the burden to local hospitals. I even spoke with one individual, and she actually has, in advance, written her obituary. That's how fearful our community is right now. You know, I know the struggle, having been 124 pounds and trying to get adjusted to certain medications. You know, the solution that you've provided through bridge funding, identified by the Health Department for the shortfall, patches the DOH's identified shortfall. Continuation of premium assistance programs and protects the eligibility at 400% of federal poverty limit. This has been the goal, and you've met that. The Senate proposal, though, is being kneecapped and undermined by the Department of Health because they're not halting their changes that go into effect in 10 days. So they're not giving the administrative rulemaking process to be complete, which by law they're supposed to. And they're also not respecting the legislature that they said there's a problem and we need you to come up with the legislative fix. They're undermining all those efforts. And they need to halt this immediately. Also, we must be mindful that DOH has directed their vendor that processes the healthcare payments to stop any further premium payments immediately, and that was last week. Therefore, we're 10 days from notice of terminations of people's insurance policies for the month of March. And that's going to cause some of these clients to also have a collections maybe of anywhere from $1,000 to $4,000 in premium that are going unmet. So they're creating greater harm to the very population that they're supposed to be protecting. You know, I just need to urge that this body, the Senate and the House, need to work together to demand that the Department of Health stand down and halt these deadly impending changes that they have coming. People will get sick and people will die. And they need to respect the fact that the legislature is authentically engaged in this process, in developing solutions. They've proposed solutions, and they need to give the budget process and time for the budget to be approved and sent to the governor and signed by sometime in June. We don't have time to wait. And if the budget is signed in June, all of this effort will be for nothing. So we need to figure out what vehicle or remedy to make sure that this gets done as soon as possible. We're fearful. I can't tell you the number of social media messages and how other people living with HIV/AIDS are reaching out to me in panic. I've even been hearing from some people in Spanish that they were never communicated to by the health department in a language in which they speak. And so not everybody's even been notified of these changes yet. Not everybody's had the chance, and you're going to be severing that relationship with the ability to get a doctor to even write a prescription. This is not the way the health department should be doing public health. And I really need to implore that this body and the Senate needs to demand the health department to halt any changes. We're in panic. And I want to thank you, Mr. Chair. You all have been really leaning in and listening, and I had a chance to meet with Senator Harrell to explain why the Medicaid and medically needy program, although it was a great thought, but just wouldn't work in this situation. And we are listening to any feedback that we can get to try to figure out how to guide clients of this program so that they can continue it. But unfortunately, that's not a viable solution for the majority of these people. There may be one or two, a very small number that might have some remedy there. But we're open to negotiations, and I have not heard back from the health department in any communications I've sent to them. And they even asked at the end of this, I went up to them before they left the meeting today to please let me know, or you're going to halt. They said, we'll get back to you. And I said, respectfully, you have not responded to any emails of mine or phone calls in a month. Thank you.
Michael, hold on one second.
Just really quickly, Mr. Rayner, thank you for your advocacy, but being a part of this population that we're talking about, living with AIDS yourself, I jotted it down and can't remember the page. You talked about people panicking with the premiums on the horizon. Could you talk to us about, from your knowledge, what do those premiums look like for people if this is not handled within the next few days?
You're recognized.
Through the chair. You know, I'm a former insurance professional, but from the property casualty standpoint, but I do have some understanding of health insurance, how it works. And one of the problems here is, you know, you need to terminate your policy, and failure to terminate will put it into collections, which will then put somebody at a greater financial disadvantage while already trying to figure out how to afford their medications. And so it could put some of these people still on the hook for not canceling their policies timely, because some companies will provide that coverage during that grace period, others won't, but you're still on the hook and responsible. And then when you consider with subsidies and other issues, it gets really complicated as to how this will hit somebody either right away or at the end of the tax year. And so it's really complex, which is even making this issue more complex for all of us to try to figure out how to guide people and come up with contingency plans. And the health department has not proposed contingency plans for clients to clearly guide how clients should be navigated off of ADAP onto other programs. They're sending us to agencies that are going to just deny any ability to assist these clients. So they're sending us down a dead end. And that's why a lot of people are fearful. We had case managers who I heard from the other day were in tears because some clients, when the letters did go out, they went to somebody's home and a family member had opened it up. And while they kept their HIV status private, a family member, such as a parent, opened up the letter and in read that your access to the AIDS Drug Assistance Program is terminated, and thereby outing that individual and their medical privacy against their will. And so there's a lot of damage that's been done by this health department, and they're not even guiding people on how to deal with the issues that still follow with stigma with HIV and the trauma that many are having. You know, a lot of individuals have overcome substance abuse issues, homelessness, domestic violence, sexual violence, and other issues. And we're worried that in some cases, we may see people falling back to using substance and lose their recovery or go back homeless. And so, you know, it's a greater storm that's headed our way that the health department has a chance to stop and minimize.